Hello, this is a video on how vaccines are created and the common misconceptions that we see in our daily world right now, especially during COVID-19. And this is by Colin. So first, many people believe that creating a vaccine only takes a few days to months. However, this is a common misconception because it usually takes years and years before an effective and a successful vaccine could be manufactured. So let's start with the first stage. The first stage is the exploratory stage. This stage usually takes 2 to 4 years, and in this stage, the federally funded academic and government scientists identify the natural and synthetic antigens that might help prevent or treat a disease. These antigens might weaken the virus or prevent it. And also in this stage, this is basically where the disease is researched. Then and next stage is the preclinical stage, and this stage is the testing stage, where animals like rats are used to test the vaccine once the exploratory stage is finished. In this stage, scientists give an estimate on which side effects are expected on humans. The preclinical stage usually takes 1 to 2 years to complete. Next stage is the IND, which is the investigational new drug application, and in this application, private companies will submit applications to the US Food and Drug Administration. The applicator will describe how the item will be manufactured, tested, processed, and summarizes the laboratory reports and describes the proposed study. The FDA has 30 days to approve the application. The next stage is where humans testing will begin, and this is phase 1. This is where 20 to 80 adults will be used for the vaccine, where the antibody or antidote. So for this stage, there will be no children used. However, if the vaccine is for children, they'll start off with adults and gradually decrease in age until they see symptoms where they get to the designated age that the vaccine is meant for. So the next stage is the vaccine trial phase 2. In this stage, the proposed is the study of safety, immunology, proposed doses, schedule of immunization, and method of delivery. In this stage, a larger group of adults will be used. In addition, there might be a few people who are more vulnerable. If the vaccine is for older people, they might have a couple older people in there, but not put a larger amount. Then in phase 3 is where they scale it up a lot, and stage 3, even a larger group of people are used. You typically thousands and thousands. In the recent study, 60,000 people were used for the vaccine. In this stage, tests are randomized and people are tested for certain side effects which did not appear in smaller groups of people or the previous phases. After a successful phase 3, the vaccine developer will submit a biological license application to the FDA. Then the FDA will inspect the factory where the vaccine will be made and improve the labeling of the vaccine. Then after this is the post-leisure monitoring of vaccines. A group of systems will monitor the results of the vaccine. After they are approved, they will also include phase 4. This will also include phase 4 in this trial. However, phase 4 is optional for manufacturers and for manufacturing or the group's private companies. Phase 4 is basically where additional trials are tested for safety, efficiency, and other potential uses of this. So in total, all testing phases will take 6 to 7 years to complete. So in conclusion, a vaccine isn't a simple process where scientists only take a couple weeks to months to complete. After you add up all the years that these testing takes, it takes a minimum of 9 years for it to complete. However, times may vary, and for example, COVID-19 vaccine took only 1 to 2 years to complete. However, this number could go up to 13 years to complete, so 13 years for a vaccine to be manufactured successfully and effective. So thank you for watching my video and stay safe.